All right. The other day when we left off, let's review what we touched on. We touched on that the our human body works on homeostasis, meaning that when everything is within normal range, everything is working perfectly, we are maintaining that homeostasis level. Okay. Now, once we get out of it, disease happens. Okay. Once we get out of homeostasis, disease happens. Medical professionals who study disease are called pathologists. Let me expand on this just a little bit more. So say you have a strange growth or a tumor or something in your body, and they say you go through it, you go to the doctor, and they see it, and they go and they do a biopsy of it. Well, when they do a biopsy of it, they're sending it to a lab so pathologists can look at it. They can look at it and see that if it's cancerous, if it's malignant, if it's benign, if it's something that they need to develop a treatment plan for you, then that's where they determine that. Or if you need to meet with an oncologist, they'll send all the stuff back to your doctor, and then if it's cancerous, then they'll of course arrange for you to start going through treatment with an oncologist. So once again, the people who study diseases are pathologists. There are two common specialties, autonomic and clinical pathology. Okay? Anatomic and clinical pathology. Remember, pathophysiology is the study of abnormal function in the body and how the disease process works. The beginning or the origin of any disease in the body is known as a pathogenesis. The cycle of disease, remember, are four parts. Okay? There's the cause, there's the incubation period or incubation time, there's the manifestation, which is the sign and symptoms. And remember, sign and symptoms are two different things. What we see are signs, what the patient tells us, what they're experiencing are symptoms. Okay? And recovery phase, the recovery time. Remember, in signs and symptoms, what you see is a sign. So I can see them vomiting. I can't see them nauseated. I can see the effects of a fever, but I can't see that I feel hot. Okay, that is a symptom. That's something the patient tells you. I can't see symptoms of dizziness. Okay, so if someone tells me that they're dizzy, I necessarily can't see that they're dizzy. Okay, I misspoke. I can actually see the signs of it. I can see them standing up and having maybe the loss of equilibrium, or them falling over, or them actually passing out, which is called a syncopal period. But I can't see signs of them feeling dizzy. Okay. Two types of diseases: acute disease and chronic disease. Remember, acute is something that is sudden onset. So let's take our heart attack, for example. AMI, acute myocardial infarction. Okay, this is what we classify as a heart attack. It's sudden, it's onset. Okay, cancer is chronic. Arthritis is chronic. Rheumatoid arthritis is chronic. Okay, this is something that happens over time. It's recurring. It doesn't happen once, then go away. Okay, that's how we distinguish between acute and chronic. Predisposing factors, we discuss age, newborn babies, by the sheer fact that they are newborn, have not been exposed to anything yet. They have not built up the proper enzymes or antibodies to try and fight off or ward off any strange pathogens. Okay. Once again, they don't have a lot of nutritional reserves. The liver enzymes are lacking, so therefore they are unable to really fight off any major infection. We discussed disease process in the elderly. The fact that their immune system, as you get older, does not work like it once did when you're 20, 22 years old. Um, your body is quicker to get out of homeostasis as an elderly person than it is in your prime, say at 25 years old. Elderly people suffer from this more because they are more susceptible to dealing with depression. The fact that you're coming to the realization that you are getting older, your body does not work the way it once did. Um, because of this, they have a tendency to isolate themselves. Think about it this way: anyone that's dealing with depression or suffering from depression has a tendency to isolate. And when you do this, multiple things happen, including malnutrition. So remember, we talked about how someone battling depression can go one of two ways. Okay, they're both are completely opposite ends of the spectrum. One can drown their sorrows in a gallon of Ben and Jerry's ice cream. Okay, or others don't want to eat. They lose the willing to eat. They don't have an appetite, and when you do this, you suffer from malnutrition. When you suffer from malnutrition, then this can take form in many different ways. This can be from a eating disorder. Okay, so it's just not from eating at all. You could be eating insufficiently. So you're purging, and then making yourself throw up. So your body's not able to absorb the nutrients in the food. Okay, so this can also lead to malnutrition. But when we're talking about malnutrition in the elderly population, we're talking the fact that typically they just don't want to eat. Either it's difficult for them to get up and go to the kitchen to cook for themselves. They just don't want to cook for themselves. They are in that depression state, so they just don't have an appetite. When all this happens, then we're dealing with a process of malnutrition. And when we deal with malnutrition, our bodies are not able to operate and work in that perfect homeostasis. We need the proper nutrients in order to do that. When we don't have those proper nutrients, we get sick. Our body becomes weak. We become more susceptible to viruses, illnesses, disease, anything that will take us out of that homeostasis. We talked about predisposing factors in regards to sex. Men are more likely to develop gout and testicular cancer. Women are more likely to develop osteoporosis and ovarian cancer and uterine cancer by the sheer by the only fact that men don't have the uterus. Okay, so therefore the women are more susceptible to that. So continuing in predisposing factors, genetic makeup. When we talk about genetic makeup, what our ancestors dealt with are the same things that we have a chance to deal with. So if diabetes runs in your family, there is a greater than zero chance that, depending on your weight, your diet, your activity level, that you could become diabetic as well. Okay, that's why when you go to the doctor and you fill out all those forms, it asks for family history. Does your family have a history of diabetes? Does your family have a history of cancer? Does your family have a history of obesity? Does your family have a history of heart attacks? And so because of all this, we are predisposed to possibly dealing with those issues ourselves. Okay? Migraine, diabetes, asthma, cancer, heart attacks, high cholesterol, anything like this. Okay? So genetics does play a role. Now, an interesting thing about this is, what about those people that are adopted? Okay? Those people that are adopted, a lot of them have turned to ancestry things like 23andMe, Ancestry.com, stuff like this. 23andMe kind of prides itself and promotes itself as, if you want to know what's in your genetic makeup, then for $99, send a swab in and we'll tell you, not only where your family's from, your lineage, but also what predisposing factors does your family deal with in regards to health. Now, for people who are adopted, this makes sense because, and I've not investigated enough to know if it's wholly 100% true, if that's actually possible. I know that 23andMe and Ancestry.com is part of a large investigation right now by the Federal Trade Commission to see if what they're promoting is actually true. But regardless of that, this is inviting someone that's adopted, because think about it. If you're adopted, And you go to the doctor and they're like, what's your family history in this? You don't know that. If you're adopted as a young child, chances are you don't know your parents. Or if you do, you definitely don't know their medical history. So you don't know if diabetes runs in your family. You don't know what things run in your family that can manifest themselves in your body as you get older. So this is definitely something that's very inviting to that part of the population that is adopted. Stress, guys. Stress is huge. Stress can make you so susceptible to so many different things. Stress can weaken arteries. It can weaken vessels. It can lead to migraines, chronic headaches. It can lead to high blood pressure. And high blood pressure can lead to a host of different things. Guys, stress impacts the body so much. Stress is a huge predisposing factor for disease process in the body. So with that, it's important for us to find ways to deal with stress, to handle stress. Go out with friends, have a hobby, do something that reduces your stress. I have several ways. I love to play golf. So I'll go out with friends and I'll go out and play golf. I love to play drums. I've been playing drums since I was about 6 years old. And so get behind the drum set or go play a gig or something like that. To me, that reduces stress. Spending time with my family, that helps me reduce stress. It gets my mind off of me. It gets my mind off onto my daughter. So in fishing is probably one of my favorite things to do. There's nothing like sitting on a boat on a lake, throwing a line in the water and just being out in nature. For me, it's very therapeutic. So these are ways to deal with stress, because if you don't deal with stress, it's going to get you. It's going to get you one way or the other. Okay, it's either going to manifest themselves in a cardiac issue, strokes. Stress leads to so many different factors, so it's important to manage stress. Lifestyle, and this goes hand in hand with stress. The way we live can determine how our body reacts to certain things. Guys, if you are living a healthy lifestyle, meaning your nutrition is well maintained, you're getting a proper amounts of protein, of carbs, of vegetables, and you maintain this, then chances are you're not going to suffer from obesity. You're not going to suffer from high blood pressure. You're not going to suffer from coronary artery disease. But once you add all this other stuff into it, like, you eat a high-fat diet, you eat a high cholesterol diet, you smoke, you vape, you do drugs, you drink, you have unsafe sexual practices. Guys, all this can lead to disease process. Smoking and vaping can lead to cancer. It can lead to cancer of the tongue, the mouth, the esophagus, the lungs, and it can lead to cirrhosis of the liver. It can lead to all sorts of different things. Having an improper diet can lead to loss of weight control. Once you add obesity in, we're adding a whole host of other factors: high blood pressure, weight on joints. So you're more susceptible to dealing with sore joints, hip problems, knee problems. Guys, our frames are not made to tolerate that much weight. If you don't believe me, look at the bodybuilder Ronnie Coleman. I've known Ronnie for years. We used to work out at the same gym when I was younger. Super nice guy. He was Mr. Olympia. I forget how many times he won it. But I mean, he's probably the most well-known bodybuilder in the world. But he's also had multiple surgeries. Now he walks using 2 canes because he has so much weight on his body, not from fat, but from muscle. His body is not made to be able to hold that much weight. Okay, and once again, I'm not talking about fat. I'm not talking about obesity. If you look at Ronnie Coleman, you understand he's not fat or obese. Okay, but just by the weight that he's putting on the body. Okay, alcohol consumption. This leads to cirrhosis of the liver. Now, I'm not saying, when you get of age 21 and older, you can't enjoy an alcoholic beverage. That's what I'm talking about. I'm talking about anything that is out of considered norm. Okay. So if you drink a lot of alcohol, it can lead to cirrhosis of the liver. It can lead to bad decision making, driving while you're intoxicated. Okay, which may lead to bad choices, which can lead to you being killed or you killing somebody else. Okay. Environmental factors. Okay. Occupation, exposure to loud noises, pollutants, repetitive movements, heavy equipment, high places. So when we're looking at this, let's look at the office worker, the administrative assistant who's sitting at their desk all day, and they develop tendonitis in the elbow. They develop carpal tunnel. Constant movement in that can also lead to a disease process in the body. Lifting heavy equipment, this can lead to back issues. Exposure to loud noises can lead to tinnitus, which is the constant ringing in the ears. It can lead to going deaf. Okay. Working high places, that can lead to you falling. And that is definitely not good. Pre-existing illnesses. Illnesses can lower the body's resistance and make individuals more susceptible to other diseases. So this goes back to what I talked about the other day. If your body is already dealing with something and a foreign pathogen comes in and introduces itself into the body, well, your body's already trying to fight off something else. Now it's trying to fight off this new pathogen, and it can't work that way. Something's got to give. One of them is going to give away to the other. Okay, so that's why when we deal with patients that are in chemo, patients that have autoimmune diseases, they're more susceptible to getting other things because their body's already trying to fight off stuff. Either that, or their body is not good at fighting off stuff. Does that make sense? Chronic illness interferes with proper function of some body systems. Okay, so thus complicating the disease process. So when you're dealing with chronic illnesses, let's take lungs, for example. If you're dealing with emphysema, okay, that's a chronic disease. So emphysema can also lead to breathing difficulty. It can lead to having low oxygen supply in the blood, which can lead to you experiencing headaches. It can lead to blood pressure issues. So it can lead to many different things. So because it's affecting one body system, it can complicate other body systems as well. Environmental exposure. The woman down in the PowerPoint in the lower corner, she loves to lay out in the sun. She loves to be tan, and you can see what that's done to her. She was actually, this is from news on ABC that did a story about her. And so prolonged exposure to cold or heat can lower the body's resistance. Okay. If you are dealing with hypothermia, then your body can deal, your body deals with certain things. If we're dealing with heat, we're dealing with heat stroke, heat exhaustion, all these things. Heat exhaustion can lead to heat stroke, which is a deadly thing that can lead to death. Hypothermia, exposure to cold for a prolonged period of time, can lead to death. You fall through ice into water and you're submerged for a prolonged period of time. This can lead to you dying. Exposure to allergens. People who are asthmatics, if your body gets that allergen, and it can trigger an asthma attack. Once again, this can take you out of homeostasis. Long-term exposure to sunlight. This can do damage to the skin. Look at the lady down in the corner. Okay, you have a higher rate of skin cancer, and so this leads to other issues. Long-term exposure to occupational chemicals. If you are working in a plant or something that uses lots of chemicals, this can cause damage to lungs as well as the skin. I know someone who worked at a chlorine plant, and there was an accident, And so they had chlorine burns in their esophagus and in their lungs and in their nasal passages. Two main disease categories, structural and functional. Structural disease involves physical and biochemical changes within the cell. Okay, so we're talking at a very microbe level here, initiated by exogenous factors. Remember, external. Okay, so things that can change the cell's makeup, excuse me, within the body, and change how cells heal. Can be anything from trauma, chemical injury, microbial infections. Okay, so these are from factors outside of the body. Okay, remember, trauma is external. Trauma is not internal. You can suffer from internal injuries through trauma, but the trauma itself is caused by an outside force. That's exogenous. Okay, then we talk about endogenous factors. Endogenous are those that are internal. Autoimmune reactions, diseases that are a result of abnormal metabolism, hyper or hypothyroidism, anything like this. This is something that's going on within the body that has a reaction, has a change onto those cells. Okay, does that make sense? Exogenous impacts the cells from the exterior. Endogenous impacts the cells from the inside of the body. Okay, these are the two categories in the structural disease. Okay, you're gonna need to know that. The hallmark characteristic of structural disease is a lesion. Okay, we have cold sore, which is a form of herpes simplex virus. Okay, HSV. Term used to describe cellular changes that result in tissue abnormalities, cuts, fractures, masses. Okay, so we see a lesion here on the lip. We see the looks like ringworm there on the arm. Okay, on the baby. Honestly, on the baby, in my opinion, that also looks like it's called dependent lividity, which is actually a sign of death. But once again, I didn't make this PowerPoint, so I'm not sure exactly what that photo is from. Functional diseases in which the onset begins without the presence of any lesion. Okay, once again, you're not going to see that herpes simplex lesion. You're not going to see the ringworm or anything like that. Basic change is physiological and is referred to as the pathophysiological change. The examples of functional diseases are tension headaches and IBS, okay, irritable bowel syndrome. Women are more susceptible to IBS than men, okay? And once again, let's go back to stress. If you're dealing with stress, then you can have a flare-up of IBS. Okay. Now there are ways to limit the IBS as far as, we can put you on medication, which kind of calms down the bowels and everything. But it's something that is a chronic condition. Manifestation of disease. Remember, manifestation refers to how a disease presents or shows itself. Remember, we saw the word manifestation when we're talking about the cycle of disease. Okay, we saw the manifestation, the sign and symptoms. All this is how does it present itself? Okay, influenza, fever, body aches, common cold, watery eyes, sneezing, more sinus-related stuff, Ebola, extreme fatigue, weakness, hemorrhaging throughout different parts of the body, bleeding through the eyes, the nose, the anus, anything like this. Okay, that's manifestation. Manifestation is also called clinical presentation. It includes both signs and symptoms. Okay, we talked about that. Signs, objective physical observation as noted by the person who examines the patient. Remember, you as a healthcare worker, anything you can see is a sign. Okay, if you can bear witness to it with your own eyes, it is a sign that you're seeing. Okay, and hold on, it'll pop up here. Object physical observations is noted by the person who examines the patient. This examination is called the physical or the physical examination. We also call it patient assessment as well. So you can call it the physical, you can call it physical examination, or patient assessment. All three are acceptable. Symptoms refer to the patient's awareness of abnormalities or discomfort. Symptoms are not measurable and based on the patient's subjective perception. Now, we talked about this: pain, nausea, weakness, fatigue, dizziness, anything in this where I can't see it, I can't necessarily test it, but it's something the patient is feeling. Okay. A written patient description of symptoms is recorded as the patient history. You, as a healthcare worker, and for those of you that want to be in the EMT class next year, the most important thing you can do as a first responder is do a patient assessment, whether it's in the hospital, in the clinic, on the ambulance. It doesn't matter. The most important job you can do is get a patient a good patient history, a good patient assessment. Think of yourself as an investigator. In this process, you're an investigator, and it's up to you to find out what is causing this person to feel this way. Without doing an adequate patient history, without doing an adequate patient assessment, and we'll talk about that. We'll start working on patient assessments. Without that, it becomes harder for us to try and figure out what's going on with this patient. Now, the more time that elapses, the sicker, the worse off this patient can get. Okay, and so any delay in our part can cause there to be a delay in treatment, and a delay in treatment can mean the difference between life and death. Okay. We're going to go and stop there for today. And we're now opening up this time for comments and questions.